Our pet overpopulation problem in this country is not a pet problem. It is a people problem. Pet owners need to understand that these procedures offer an alternative. The dog can't get pregnant, the dog can't reproduce, and we've left all the body parts intact. Hi, I'm Dr. Judy Morgan, your pet's advocate, and today I want to talk about the new guidelines for spay and neuter for dogs and cats. The World Small Animal Veterinary Association has new global guidelines on surgical and non-surgical approaches to sterilizing cats and dogs. In the past, we have always just parroted what we were taught in veterinary school for the past 50 years, that we should spay and neuter by 6 months of age so that we never allow a cat or dog to go into heat. Hopefully, if we do them by 6 months of age, most dogs will come into heat around 7 months of age. Some of them, it can be much later depending on the breed. Most cats will be cycling between 5 and 6 months of age. And also for population control at shelters, they have routinely in the past maybe 15 years, 20 years, started spaying and neutering as young as 8 weeks of age. I know the local shelter by my clinics in New Jersey, once the pet reached 8 weeks or 2 pounds of body weight, they were in for spay and neuter before adoption because of population control problems. So we have some studies that have come out over the past decade that have shown that maybe we've been doing it wrong. So I want to talk about these new guidelines and some things that kind of go along with those decisions and help in decision making for the pet owner. So this actually came out in May of 2024, the World Small Animal Veterinary Association, which we call WSAVA, guidelines for the control of reproduction in dogs and cats. And it provides veterinarians all over the world with the latest scientific evidence for making science-based decisions regarding the management of reproduction in their patients. It's a 136-page document covering current sterilization practices, along with explanations of newer approaches, and we've talked about those in other videos. Both surgical and non-surgical ways that we can deal with this, and exploring the health benefits and drawbacks of each method, along with any ethical considerations. So a great document. Committee members pulled together hundreds of scientific publications covering all aspects of canine and feline sterilization and contraception, as well as health outcomes and decision-making processes. Their guidelines feature specific techniques and diagrams to assist veterinarians in performing new procedures, which many of these have not been taught in veterinary school, and also addresses the impacts on health, behavior, and longevity of removing the ovaries and the testes and hormone-sparing sterilization, where we leave those in place so that the hormones remain in place. And what they concluded is that the best options for reproduction control in dogs and cats are the ones that have the least long-term health concerns. Well, duh. Unfortunately, we've been doing it wrong for so long that retraining everyone to think about this differently is going to take a lot of work. Just like when we started retraining everyone to think about vaccinations as something other than the annual vaccines that we were taught for so long were, the way to do everything. And we discovered, gee, that really wasn't so good for our animals, and maybe we should do it differently. But it's taken a long time to make these changes, and I think that this will take a long time to get the changes through the heads of the veterinary schools and the veterinarians who are practicing. It says for owned pets, this is not shelter, for owned pets, a decision should be made on a case-by-case basis in consultation with the owner, with due consideration of the species, so cat, dog, the sex, male, female, the breed, the purpose and lifestyle of the pet, as well as any financial constraints that the owner may have. For shelters, the guidelines say that cats and smaller breed dogs may continue to be gonadectomized, meaning the ovaries and the testes removed, by traditional means at traditional ages. So they're basically saying, yeah, if you have a shelter and you've got a bunch of 8-week-old puppies and kittens, go ahead and keep doing what you're doing, which is not great. Conversely, vasectomy and ovary-sparing surgery should be offered as an alternative to removing the ovaries and testes following proper consultation with the prospective owners. So, gee, wouldn't it be nice if shelters had a conversation with people and gave them the option to have those gonads left in place? That would be amazing. I think that is going to be a long time coming, especially for large and giant breed dogs at risk. Citing a May 2023 3 study in the Journal of the AVMA that showed gonadectomy, removing the ovaries and testes, increased overweight or obesity risk for most dogs compared to intact dogs. There's a lot of other things that are increased risk as well. Surgical site infections are a significant concern in patients undergoing a spay or neuter, vasectomy, whatever we're going to do. But we have a lot of data that show that automatically giving antibiotics is probably not necessary because of antimicrobial resistance in human and animal medicine. The guidelines say that prophylactically giving antibiotics at the time of surgery should be avoided in routine sterilizations if they are brief, performed in a clean environment, which every veterinary hospital should be a clean environment, and there's no other factor predisposing to infection. So I've done other videos where I've talked about the overuse of antibiotics. If you have a pet that is going in for a sterilization procedure and the estimate has on there an antibiotic injection, I would recommend saying no to that antibiotic injection because it's been shown that it is just not necessary. The same goes for dentals and other procedures. All surgical procedures are painful, therefore adequate pain medication is mandatory in every situation according to the guidelines, which that makes perfect sense. Management of surgical pain begins before surgery, is maintained throughout the surgical procedure, and is continued afterwards. Multi-modality management of pain is preferred using local anesthetic techniques in addition to systemic. Ultimately, the decision of whether and how to spay, neuter, or sterilize an animal should be based on a thorough assessment of the individual animal's health and client preferences, is what the guidelines state. So hopefully veterinarians will see this. I don't know if anybody's going to read a 136-page document, but at least if they look at the highlights, maybe they'll get some ideas that maybe there are better ways to do things than what we've been doing in the past. This is information from studies that were done at UC Davis, University of California at Davis, at the veterinary school. They had a study that suggested that early neutering of golden retrievers put them at increased risk of joint diseases and certain cancers. So that was the initial study. I don't know what year it came out, but it was quite a while ago. They said, oh my gosh, maybe spaying and neutering and removing the gonads of these dogs is not a good thing. So that initial study set off a flurry of debate about the best age to neuter other popular breeds. So a couple of professors at UC Davis said, hey, let's go back through all of the records because they have thousands of dogs that have been seen at University of California Davis Veterinary Hospital. And so they wanted to help pull together information to help pet owners make the decision for their animals going forward. So they specifically looked at the correlation between neutering or spaying a dog before 1 year of age and the dog's risk of developing certain cancers. They include cancers of the lymph nodes, bones, blood vessels, or mast cell tumors for some breeds, and joint disorders such as hip or elbow dysplasia or craniocruciate ligament tears. Joint disorders and cancers are of particular interest because neutering removes male and female sex hormones that play key roles in important body processes such as closure of bone growth plates. For their most recent study, they focused on German short-haired or wire-haired pointers, Mastiff, Newfoundland, Rhodesian Ridgeback, and Siberian Husky. Data was collected from their hospital records that included more than 200 cases for each of the 5 breeds weighing more than 20 kilograms or 44 pounds from January 2000 through December 2020. So they had 20 years of records to be able to look at for these specific breeds. Their updated guidelines emphasize the importance of personalized decisions regarding neutering of dogs, considering the dog's breed, sex, and context. The study found major differences among the breeds for developing joint disorders and cancers when neutered early. Male and female pointer breeds had elevated joint disorders and increased cancers. Male Mastiff breeds had increased craniocruciate ligament tears and lymphoma. Female Newfoundland breeds had heightened risk for joint disorders. Female Ridgeback breeds had heightened risk for mast cell tumors with very early neutering. And Siberian Huskies showed no significant effects on joint disorders or cancers. Go Huskies, I guess. So really interesting that they had that many cases that they could look at, and so they could make very specific guidelines. And really what we need to do is look at all breeds. We have found more issues related to large breed dogs than to small breed dogs, but I think we need to look a lot more closely at the changes that we see across all breeds. Another thing that has been recommended is just doing ovary sparing spays and taking out the uterus. One option for shelters might be doing ovarian sparing spays and just removing the uterus from the young puppies or kittens. There's a very interesting study that was published in 2018 in the journal Endocrinology, where they studied hysterectomy, leaving the ovaries, basically an ovary-sparing spay, where the uterus was taken out, and they were studying rats, and they gave the rats tasks to do and looked at whether removing the uterus had any effect on the mental capacity of the rats. And they did this because so many women undergo hysterectomy for problems, but the ovaries are either left or taken, and they wanted to look at, is this causing any problems? And it was really interesting. So the dogma and the thought, the belief has been that the non-pregnant uterus is dormant, that the uterus doesn't contribute anything. It basically is just sitting there waiting to carry a baby. However, uterus removal alone, so leaving the ovaries, had a unique detrimental impact on the ability to handle a high-demand working memory load. The findings demonstrated that the uterus is not dormant, and it indicates that there is an ovarian uterus brain system that becomes interrupted when the reproductive tract has been disrupted, leading to alterations in brain function, cognitive dysfunction. In people, we might look at that as dementia or Alzheimer's, but we know that we have cognitive dysfunction in our older dogs and cats. Particularly in the older dogs, we see it very commonly. Is this because their uterus was removed? Did that have an impact on how the brain functions and how they're going to age? Should we be looking at that? The study says the uterus and ovaries are part of an intricately connected system, including the hypothalamus, which is a gland in the brain, the pituitary, also in the brain, and the female reproductive tract. During the past few decades, it has become clear that this system, as well as all the hormones that it produces, influence domains reaching far beyond reproduction alone, with actions on many body systems, including the brain. The uterus is tightly linked to the hypothalamic pituitary ovarian axis loop and the potentially wide-reaching effects of the system. Indeed, despite the long-held dogma that the non-pregnant uterus is dormant and a useless organ, there is evidence that the uterus contains gonadotropin and steroid hormone receptors, as well as direct sensory and autonomic innervation from the central and peripheral nervous systems. Hysterectomy itself, just removing the uterus, sufficiently alters the hypothalamic pituitary female reproductive tract system, and as a result plays a role in altering the brain and cognition. Several recent retrospective clinical studies have reported an increased relative risk of early onset dementia for women who underwent uterine removal compared with women with no history of uterine removal. We have to look at that as well. Now, we could argue that our dogs and cats don't have to perform complicated tasks. They basically need to find their food and find the way outside to go potty, but are we causing more problems by interfering with the reproductive tract? What is ideal? Well, responsible pet ownership is the most ideal. Our pet overpopulation problem in this country is not a pet problem. It is a people problem. It is an irresponsible pet owner problem. In dogs, we generally want to choose the option that leaves as many body parts intact as possible. So how do we leave the uterus and leave the ovaries so that we have all the hormonal influence, but the dog can't be bred, the dog can't make more puppies, can't contribute to pet overpopulation? Well, we can do a tubal ligation. They do them in women, so we can do a tubal ligation. The dog can't get pregnant, the dog can't reproduce, and we've left all the body parts intact and we've left the hormones intact. For our males, we can do a vasectomy. It leaves all the glands there, it leaves the gonads there, they're not able to reproduce. That would be great. What we need is for our veterinarians to all be taught how to do those procedures, which the Parsimus Foundation is a great place to learn all that information, and we need to get our veterinary schools to start teaching these procedures so that the veterinarians feel comfortable doing them. I could do a cat spay in about 4 minutes. I can do a cat neuter in 1 minute. I can do a dog spay, depending on the size of the dog, in anywhere from 8 to 12 minutes. It's so easy to do. Is it going to be harder to do a tubal ligation? No, should be even faster. Is it harder to do a vasectomy? The first few that you do? Yes. Once you feel comfortable doing them, it should take no longer than a normal castration. So I think that our veterinarians need to learn these procedures. Pet owners need to understand that these procedures offer an alternative, and leaving things intact Now, that brings us to people who are going to say, oh my gosh, pyometra, the risk of pyometra and the risk of mammary cancer. Let's talk about that. Great studies out of Scandinavia, because those countries have different feelings about spay and neuter than we do here in America. And most of the animals there are intact. In our blogs, we have links to those studies that show the incidence of mammary cancer and pyometra in those countries. I think most of the studies that we looked at were for dogs, but the incidence is actually very low. There was a study that was printed in the Journal of the American Veterinary Medical Association a few years ago that showed, people are so worried about a pyometra. Oh my gosh, my dog will die from the pyo. My dog will die from the surgery from pyo. In this study that they did, 95% of dogs presented with pyometra, which is an infection in the uterus, had successful surgeries in non-specialized settings like shelter medicine, spay neuter clinics, sort of the lower level surgical centers. 95% success rate. The thing with pyometra is you as the owner, if you have an intact female, you need to know the symptoms of pyometra, the increased thirst and urination, the lack of appetite, lethargy, and it usually occurs about 8 weeks after they go through a heat cycle. So just be vigilant, and if you think there's a problem, get the dog in and get them seen and have surgery if it needs to happen. It's not a legitimate, oh my gosh, this might happen. It's not a large percentage where it happens, so I don't think that that is a legitimate reason to do early spay on our females, because something might happen down the line. So I want to talk about how cats are a little bit different and talk about mammary cancer a little bit. So the studies out of Scandinavia showed that the incidence of mammary cancer, malignant mammary cancer in intact dogs was pretty low, really pretty low. And so again, they did not consider that that was a preemptive reason to spay our dogs at a young age. So we'll talk about mammary tumors in cats. Mammary tumors are among the most common cancer in both cats and dogs, but the prevalence of malignant cancers is far higher in cats. So a lot of times when we get a mammary cancer in a dog, it's going to be benign. In cats, the ratio of malignant to benign is at least 4 to 1. So 4 times greater chance that it's going to be malignant if it's a cat. The more aggressive nature of mammary cancer in cats poses challenges for management. Prognosis is affected by tumor size, and therefore early recognition and treatment of mammary tumors is paramount. Although the primary tumor can be surgically removed, no studies have shown that chemotherapy significantly extends survival time. Hence, metastatic spread remains an important clinical problem. Mammary tumors usually affect older female cats, usually intact females, and the Siamese and Oriental breeds seem to be more predisposed. Male cats can develop mammary cancer, but it's rare, just kind of about like people. Mammary cancer is the third most common tumor type affecting female cats after lymphoma and skin tumors, accounting for about 17% of tumors. Reported incidence is 25 per 100,000 female cats per year. It's pretty low, and it says precise statistics are not available. The incidence of mammary tumors may vary globally depending on cultural acceptance of neutering policies. Neutering is less common in Scandinavia and some other parts of Europe than in the UK, for example. As in humans and dogs, hormonal fluctuations associated with repeated heat cycles may influence the development of mammary tumors in cats. This is supported by a case control study reporting that cats spayed after 1 year of age had a decreased risk of developing mammary cancer, and intact cats were 7 times overrepresented in a population of cats with mammary tumors compared with the control group. Definitely have a higher incidence of mammary tumors in intact female cats than we do in female dogs. However, cats spayed at less than a year old can still develop mammary tumors, so the effect of early neutering does not eliminate the risk of mammary tumors, and early studies reporting more tumors in intact cats may possibly have reflected neutering practices at the time rather than a true increased risk. So, don't know. There is no definitive evidence for a viral etiology or cause for mammary tumors in cats, although this was proposed in early literature. And obesity has not been implicated, unlike in dogs. So mammary cancer has a link to obesity in dogs. And the mainstay of treatment for mammary tumors is surgical resection. If you find it, you've got to get them removed. The earlier you find the tumor, the faster you get it removed, the better the chances of recovery. Concurrent ovariohysterectomy, so spay, there is no evidence that spaying at the time of the tumor removal has any benefit on survival or tumor recurrence or effect on development of new tumors or cancer progression. However, it might reduce the need for progestin therapy, which may be beneficial. So there's nothing that says if you have a cat that you're getting a tumor taken off the mammary glands that you have to have have them spayed at the same time. Prognosis is guarded for most cats with mammary tumors, with deaths mainly attributable to local recurrence or metastasis. The average time between detection and death is reported to be 10 to 12 months. It's not great, but several factors will affect the prognosis. In dogs and cats, we have a comparison of mammary tumors. The cause is hormonal for both dogs and cats, but in dogs there's also a link with obesity at a young age. Mean age for cats is 10 to 12 years, with Siamese and Oriental and domestic short-hair cats being mostly affected. Usually intact females, rare in males. When it is seen in males, it's pretty aggressive. In dogs, the mean age is 6 to 10 years that it's diagnosed, so a little earlier. Poodles, dachshunds, and spaniels are the most affected. Usually intact females, rare in males, and when it's seen in male dogs, it's more benign. So male dogs benign, male cats aggressive. Metastatic spread is less frequent in dogs than cats. In cats, 80 to 90% of the tumors are going to be malignant, and in dogs, 50% of them will be malignant. So treatment, surgery for both, chemotherapy for both, no conclusive evidence that it helps. Prognostic factors include the size of the tumor when it's found, the clinical stage, and the histologic grade of the tumor. We need to think differently. We need to look at the new WASABA guidelines, and particularly if you have a large breed dog, 1, keep them from becoming obese. 2, really look at what the studies show for that particular breed and the size of the dog, and make decisions based on the lifestyle, what you can tolerate, what makes the most sense to you. Some people absolutely cannot deal with a dog in heat. Some people say, oh, intact male dogs are more aggressive. Actually, the studies show that that's not true. It's the opposite, that neutered dogs have more behavior and aggression problems. So again, we need to look at things differently. I get it, shelter medicine is its own thing, but wouldn't it be interesting if shelter medicine included tubal ligations and vasectomies as routinely as it does spays and castrations right now? Let's think about it differently.